Well, state leaders say coronavirus antibody testing could be a game changer when it comes to learning more about the virus. In fact, today, Ohio's health director, Dr. Amy Acton, says testing shows COVID-19 has been in Ohio much longer than we thought. Here's Laura Caso.
More testing means more findings, and Dr. Amy Acton says antibody testing shows coronavirus was in Ohio much earlier than March.
We have found 5 cases now that the date of onset of symptoms was in January.
5 cases in 5 counties. She says antibody testing will help determine how those patients were exposed. And that antibody testing is happening. Maybe you are one of the 1,200 Ohioans who got a postcard in the mail today from the Ohio Department of Health asking you to participate in random coronavirus antibody testing.
They're volunteering to help us learn more about the prevalence of this disease, many of whom may not know they've already had it.
The tests look for antibodies we naturally produce to fight off these viruses. If they detect specific antibodies in our blood, we've likely been infected at some point by COVID-19. University Hospital doctor Keith Armitage says he's enthusiastic about the blood test, but warns no one should let their guard down.
And so what we don't want to have happen is people that get an antibody test and then not take precautions. I think even if you get the antibody test, you should still take precautions until we know.
Because there are still unknowns when it comes to COVID-19. That includes the mysterious illness affecting children and linked to COVID-19. Rainbow Babies and Children's Hospital confirms 1 case there and 4 suspected cases of what's now being called pediatric multi-system inflammatory syndrome. The rare illness causes life-threatening inflammation in the body and organs.
We're seeing kids needing to be put on like heparin or blood thinners because the inflammation is making their blood too thick or is putting them at risk for clotting.
It can affect young kids to teenagers. The first warning, a fever.
4 or 5 days of high fever, abdominal pain is a big part of this, diarrhea.
There have been 3 deaths reported in New York, but overall doctors say most children recover. Right now, there are about 100 confirmed cases throughout the country. We know of no known cases at Cleveland Clinic, Metro, or Akron Children's Hospital. Laura Caso, 3 News.